Hey guys, here are 5 things I found interesting this week from the world of evolution and public health. Number 1. Ozempic can help you shed pounds, but could it also save your life?
A new study finds that people on semaglutide, the active ingredient in Wegovy and Ozempic, were surprisingly less likely to die,
Participants who got the drug had lower rates of death from any cause.
dying at a rate that was 19% lower compared to people who got the placebo. But the drug also lowered the risk of dying from COVID-19.
Which is weird because we don't usually think of weight loss and infectious disease as being linked, so how could that be?
One possible explanation is simply that semaglutide makes people lose weight, and weight loss can lower inflammation and improve metabolic health. Excess fat, especially around internal organs, triggers the body's immune system to react as if it were under constant threat, which leads to inflammation and a bunch of health risks. Semaglutide might lower your odds of dying just by tamping down on this inflammation.
Regardless of how this works, it could revolutionize how we think about managing obesity-related risks. Number 2. Sloth fever might sound like some Gen Z anti-work trend that's freaking out the boomers, but it's actually a viral disease that spread quickly in the Americas.
The disease is called Oropouche, nicknamed sloth fever since it can infect sloths. And there have been about 8,000 cases reported so far this year in these countries, with a few deaths.
We don't know much about the mysterious Oropouche virus.
But a recent unpublished study suggests that a novel reassortment of the virus, essentially a bit of genomic reshuffling, might have let the virus replicate way more efficiently, leading to its increased spread.
The prime suspects for Oropouche virus transmission between people are biting midges,
Which are way smaller than mosquitoes.
We haven't historically had sloth fever in the US, but we do have the biting midges that transmit the virus.
The Gulf Coast states, Puerto Rico, and the Virgin Islands could have the right climate to let Oropouche gain a foothold on U.S. soil. If someone from Florida goes to, say, Carnival in Rio and brings sloth fever home as a souvenir, the worry is that they could pass it to others if they're bitten by one of these midges. We've had 32 cases of sloth fever in U.S. travelers so far this year, including 30 in Florida, so it's something to monitor.
Number 3. How could bats save the lives of babies?
A remarkable paper by Eyal Frank came out this week, reporting that the loss of bats led to farmers increasing their pesticide usage, which in turn led to an increase in infant mortality. Bat numbers have been dropping sharply due to white nose syndrome, a fungal disease that emerged in 2006.
This sucks for the bats, obviously, but it also sucks for us,
since bats provide us with billions of dollars in agricultural aid by eating insects that threaten our crops. Frank used the spread of white nose syndrome to show that when bat numbers go down, farmers have to compensate by using more pesticides.
The incredible part is that in those counties where bat numbers went down and pesticide use went up, infant mortality also went up by 8%. I admit that I didn't believe this when I first read it, or maybe I didn't want to believe it.
But there are a few studies supporting the notion, the strongest being one from Brazil that links glyphosate, the ingredient in Roundup, to an increased infant mortality rate. It's an amazing and elegant and very smart study, underscoring the interconnectedness of people and biodiversity.
My lab might actually be starting a project on bat white nose syndrome soon, so it's good motivation. Number 4. A groundbreaking discovery about COVID-19 was just announced this week. Researchers wanted to know why patients with COVID-19 can suffer from life-threatening blood clots and neurological symptoms, which can persist in patients with long COVID.
They found that fibrin, a key protein in blood clot formation, binds to the SARS-CoV-2 spike protein, leading to harmful inflammatory blood clots. These clots contribute to inflammation in the lungs, oxidative stress, and even brain damage, which may explain the cognitive problems seen in people who have even mild COVID infections. This is my favorite figure from the paper, showing fibrin clots formed in plasma, both with and without the spike protein. It shows that when the spike protein is present, the fibrin fibers become thinner and more densely packed, which is characteristic of a more resistant and inflammatory clot. These difficult-to-break-down clots drive inflammation and organ damage, especially in the lungs and brain.
As someone who relies on their brain to make a living and doesn't want to die of a blood clot, I was very excited to see this study come out, since identifying fibrin as a main suspect in COVID-19 could lead to new treatments.
Excitingly, a monoclonal antibody targeting fibrin's inflammatory effects has shown potential in protecting against lung inflammation and brain injury, offering hope for future treatments in both acute COVID-19 and long COVID.
Number 5. When you hear polio, you might think of FDR and kids in iron lungs, but polio hasn't been eradicated, and it can still spread wherever kids aren't fully vaccinated.
People were therefore terrified last month when an unvaccinated 10-month-old child in Gaza came down with the potentially fatal, paralyzing disease.
Gaza had been polio-free for 25 years, with good rates of vaccinations.
However, the war disrupted all of that. The 10-month-old boy who had paralysis from polio, for instance, was born just before the October 7th attacks. With Israel bombing hospitals, kids like him couldn't get their necessary vaccinations, especially since his family was displaced and had to move 5 times, eventually settling in a tent city.
Thankfully, this week saw a massive polio vaccination effort during temporary pauses in military operations,
with the goal of vaccinating 640,000 kids. That, alongside a ceasefire and the rebuilding of medical and hygiene systems, will hopefully help stop avoidable Palestinian deaths from polio and other infectious diseases.
Stories like this one hit different now that I have a little one of my own, who coincidentally is getting the first dose of her polio vaccine tomorrow. I worry about a lot of things for her, but thankfully polio will not be one of them. Hopefully, moms in Gaza will be able to say the same soon. Please subscribe if you want to hear about the latest updates in the worlds of evolutionary biology and public health, which will be posted every Saturday.